Hi there, my name is Jenny and today we're going to be demonstrating how to insert a urinary indwelling catheter. The first step would be to introduce yourself to the patient, and then at that point you would verify the patient's identity using two appropriate identifiers, such as their name and date of birth. Once that is complete, then you would verify the provider's orders and if there's any allergies that the patient may have. Once that is done, the next step would be to gather the supplies. Upon returning to the room, the supplies should be set up next to the patient's bedside, and at that point we would perform hand hygiene and we would explain to the patient the steps in the procedure. The packaging, I have already opened my packaging and replaced a few things that I didn't know needed to be sterile. So after reviewing the module again, re-recording the demonstration. So once we open the packaging, it comes wrapped, I guess in a paper-like form. So we would unfold that and we would leave it as is with the outer covering open. We are not to touch the box itself because we do need to practice surgical asepsis. But with that being said, the first step once we open the catheter kit is to grab the sterile drape without adding our sterile gloves yet. But we pinch a corner of the sterile drape and we open it carefully and place it in between the patient's legs. Okay. Then at that point we would don sterile gloves and prepare the sterilization kit, the catheter kit. Okay, so we would open it. Okay, now at this point, we can take the box after we have prepared like the lubricant, the antiseptic wipe. So we would this entire box is sterile. So we can place this here. And normally this would be prepared elsewhere, but in order to prepare the contents of the box, it would be sterile. Okay. So in this case, we don't have the iodine, so we'll be using the antiseptic swabs. This part of the balloon we would have ready. Again, this is all in a sterile field. Okay. Now with the non-dominant hand, we would spread the labia, exposing the urinary meatus, and we would clean that in one direction from the clitoris to the anus and then discard. And then we would do that again using a brand new swab each time from the clitoris to the anus in one direction and dispose. Okay. Then once that is done, we would get the tip of the catheter and we would lubricate it with the jelly, and then we would begin inserting it. We would leave our non-dominant hands spreading the labia, okay? Then we would begin inserting the catheter until we see a flash of urine, okay? And then while still keeping that hand, we would at that point begin inflating the balloon. Bless you. Okay. And we would hold the urinary catheter in place to avoid it from exiting. Okay. Now that is done. Okay. We would at that point, we can remove now our hand from the patient since it is in place. We would remove our sterile gloves. Perform hand hygiene for at least 15 to 20 seconds. And we would attach the urinary catheter to the patient's thigh and along the bedside. Okay. And everything else would be tossed away. And that's that. And that is the way that you insert a urinary catheter using surgical asepsis.